Best tips to lower your A1c levels. If you have diabetes, you will know the importance of regularly checking your blood sugar levels. In addition to the regular blood sugar tests, most doctors recommend that you do an A1c test at least a couple times a year or more if possible. This will ensure that you stay healthy and that you take proactive steps to control any fluctuating blood sugar levels before they are harmful to your body. And like a regular blood glucose test, which indicates the instant blood sugar levels, the A1c measures the amount of sugar that attaches itself to a protein known as hemoglobin, which is in your red blood cells. The test measures the average blood sugar levels over the past few months, so you and your doctor can know exactly how to control your blood sugar in the future. Generally, it is recommended that your A1c levels be kept at 7% and below. You should aspire to have this value as far below the 7% as you possibly can, because this will ensure that you avoid complications such as eye problems, heart disease, and nerve damage that can be brought about by elevated blood sugar levels. There are many different recommended strategies to bring down your A1c levels, but the following tips and tactics will help you get there faster, in addition to taking your medical prescriptions. Number 1. Get yourself some new kitchen tools. If you do not already own a set of measuring tools in your kitchen, it may be desirable to purchase a new set of measuring cups and a kitchen scale. It doesn't have to be anything expensive or a fancy digital scale. Simple plastic measuring cups are all you need. Eating more food than your body needs is one of the things that brings elevation of blood sugar levels. So therefore, keeping the servings in check is a very good way to reduce your A1c levels. Initially, it's a good idea to use these tools to measure the sizes of the portions of food. With time, however, you'll find that it's no longer necessary to use these tools, as you'll become quite good at simply looking and estimating the appropriate portion sizes without having to use the cups. It may surprise you to see exactly how much food is in a single serving. It may look small, especially for the high-carb foods like cereal, rice, bread, and pasta that you may be consuming a great amount without your knowledge. These will help ensure that you do not overeat and that you maintain appropriate food portions. Number 2. Become carb-serving. Carbohydrates have a more drastic effect on your blood sugar levels than any other nutrients in your diet. There is a high probability that if you already eat more carbs than you need regularly, your A1c levels will become elevated. It is important, however, to understand not all carbs are bad. You need the carbs that have a lot of fiber in nutrients and should avoid those that are rich in starch. Number 3. Be mindful of your plate's geometry. Nutritionists tell us to fill half the plate with vegetables which are low in starch, such as cauliflower, baby corn, artichokes, carrots, or mushrooms. 1/4 of the plate should be filled with lean proteins such as white-fleshed fish, chicken breasts, breast tenderloins, tenders, and wings. Avoid the skin though. The remaining part of your plate should be filled with whole grains such as quinoa or brown rice. Number 4. From your plate to your mouth. Although it may look easy to make decisions as to what to put on your plate, it is always advisable to make plans ahead of time regarding what eventually ends up on your plate. Why is this so? How and what you eat, especially if you're a busy person, always on the move, there is a high possibility that you will end up eating more than you need. You probably will end up eating high-calorie carbohydrate-loaded meals like hamburgers, frozen pizza, fries, which could all cause your blood sugar numbers to skyrocket. It is advisable to start each week with a rough idea about what food you like to eat at each meal and what groceries you need to prepare these foods. This will give you plenty of choices that reduce the probability of post-meal blood sugar spikes. A Mediterranean diet is one of those diets that is recommended because of its low saturated fat and has a high proportion of vegetables and fruits, which are very reliable in lowering A1c numbers. Number 5, don't be so hard on yourself. Relax your weight loss goals. Having diabetes may be associated with being overweight. However, not all people with type 2 diabetes have a weight problem. However, if you do, you may not need to lose as much weight as you would imagine to make a difference in your A1c level. When you're overweight, diabetes doctors often suggest that you lose just 5 to 10% of your current weight. The reason for this is that as you shed those extra pounds, the insulin in your body effectively lowers your blood sugar, which reduces your A1c level with time. One study revealed that people who lost between 5 to 10% of their body weight were 3 times more likely to reduce their A1c levels by 0.5%. Because weight loss goals will differ from person to person due to other health considerations, ask your doctor to help you make a concrete plan that will be unique to your situation. General health and weight loss goals. Number 6, reconsider your exercise plan. Apart from upgrading your nutrition plan, exercise is the second and very important part of this equation that has a profound effect on your A1c levels. But don't simply run for miles on your treadmill because your knees will hurt and you will miss another effective workout regime, the strength training. It really doesn't matter which is the best exercise because in the long run, no pun intended, it is your consistency and a regular routine that yields benefits. Your A1c levels will be lowered whether you opt for resistance, strength training, or aerobic exercise, provided you make it part of a regular routine. There is solid scientific evidence that shows that working out helps bring down your A1c levels. This is because exercise makes your muscles take more sugar from your bloodstream, thus reducing the blood sugar levels faster after you eat a meal. After you make exercise a part of your daily routine, you will see a consistent fall in your A1c numbers. Number 7, never skip your meds. While you can certainly reduce your A1c levels through diet and exercise, it is essential that you never skip a dose of your medication. This is particularly important if your doctor has prescribed medication like glycet, insulin, metformin, and others. It is essential that you take all your prescriptions exactly as prescribed. Because diabetes is a syndrome of several different diseases, skipping diabetes medication will result in other associated conditions being exacerbated. These are conditions such as high blood pressure, elevated cholesterol levels, and bringing the onset and worsening of kidney disease, among many others. And your A1c levels will reflect that. When you take your medications as prescribed and keep all your doctor's appointments, your blood sugar will be maintained very well, and your A1c levels will reflect that. If your ultimate goal is to cut down or totally eliminate your need for the medications in the long run, discuss this with your doctor and work together to attain that goal. Whatever you do, you must never stop taking your medication on your own, as this will result in dire consequences to your health. Number 8, be careful while taking supplements. There are many supplements today which claim to lower A1c numbers. You should be wary of them as there is no concrete research so far that supports this assertion. A few supplements, however, look promising and you may want to try them out, but with all supplements, you will want to seek your doctor's advice first. Plant-based extracts like berberine may have the best benefits. Others include antioxidant supplements like coenzyme Q10, CoQ10, which are known to reduce inflammation in the body. Cinnamon may lower your A1c if taken continuously for a period of time. Number 9, persistence is key. Obtaining the A1c levels you want is more like a half marathon race than a sprint. This is because the A1c is an average of your blood sugar levels over a period of several months, and it will therefore take that long for it to stabilize and then drop. You may not be perfect. At times you may even fail to do the right things, as we have discussed here. If you keep with it and continue moving in the right direction, everything will come together in the end. Your A1c numbers will come down and your effort will be well worth it. Number 10. Check your blood sugar levels. Last but not least, check your blood sugar levels consistently as directed by your doctor. The A1c test is not intended to be a replacement of your regular blood tests. These tests capture and record any day-to-day fluctuations in your blood sugar, which may be masked by an A1c result that is at your goal level. If you take good care of your day-to-day blood glucose levels, the follow-up A1c levels will take care of themselves.